Hello, I'm Dr. Al Feinblatt, a chiropractic physician who has been practicing in Wooddale since 1983. I have treated patients from the very young to age 96. I have treated patients in all walks of life, including professional athletes. I have treated thousands of patients with varying conditions from headaches, backaches, neck aches, arm and leg pain, to dizziness, unstoppable hiccups, asthma, stomach problems, and bedwetting. I really love what I do. I enjoy my professional relationships with my patients and really feel good when I help my patients feel better. While I work hard at what I do, while I take continuing medical education seminars and classes to stay abreast of the latest treatment techniques, I truly believe that it is only with God's help that I'm able to help my patients. Let us talk about the thyroid gland. The word thyroid comes from a Greek word meaning shield. As a shield, the thyroid has some very crucial functions in your body. A very important fact to grasp is that every cell in the body has receptor sites for thyroid hormones, including red blood cells. Thyroid hormones are responsible for the most basic and fundamental aspects of physiology, the basal metabolic rate. A lack of ideal thyroid hormone leads to global decline in cellular function of all bodily systems from your brain to your toes. To indicate how pervasive thyroid hormonal activity is, thyroid hormones affect energy production, bone mass and bone quality, cholesterol levels, red blood cell activity, stomach acid levels, gastrointestinal transit time, intestinal tissue regeneration, gallbladder function, and arterial wall health. As an interesting tidbit, for a tadpole to turn into a frog, proper thyroid function is a must. Isn't that amazing? Let me introduce a phenomenon called crosstalk, which means two body systems are interdependent on each other for proper function. There is thyroid immune system crosstalk, thyroid brain crosstalk, thyroid endocrine system crosstalk. This means that these systems must be functioning optimally for you to feel well. To sum up the importance of an optimally functioning thyroid gland, the thyroid gland has an effect on the brain, gastrointestinal tract, liver function, liver and cholesterol metabolism, lipid and cholesterol metabolism, protein metabolism, red blood cell metabolism, glucose metabolism, hormone steroidogenesis, bone metabolism, and your cardiovascular system. There are 10 metabolic steps for proper thyroid hormone production and activity, and they involve the brain, the thyroid gland, the liver, the gut, and the body cells. A malfunction anywhere in these 10 steps can lead to thyroid problems. So now that I've told you what the thyroid gland does, how it produces thyroid hormones, and how crucial thyroid function is to your body, I will discuss some of the symptoms of thyroid deficiency. If you are hypothyroid, you may be experiencing any of the following symptoms of hypothyroidism: feeling fatigue, tired, or sluggish, having cold hands and or feet, requiring excessive sleep, weight gain, having difficult or infrequent bowel movements, depression, lack of motivation, morning headaches that wear off as the day progresses, thinning hair or excessive hair falling out, dryness of the skin and or scalp, mental sluggishness. If you are hyperthyroid, you may be experiencing any of the following symptoms of hyperthyroidism: heart palpitations, inward trembling, increased pulse rate even at rest, nervousness and high emotional state, insomnia, night sweats, and difficulty gaining weight. You may be suffering from Hashimoto's, which is an autoimmune disorder in which the patient's immune system attacks the thyroid gland. Patients who suffer from Hashimoto's experience some or all of the symptoms of either hypothyroidism or hyperthyroidism. There are other thyroid conditions such as goiters, thyroiditis other than Hashimoto's, euthyroid sick syndrome, thyroid nodules, thyroid cancer, but I won't go into them in this presentation. Now let's talk about how we treat thyroid conditions and how I can help you feel better. I'll talk about how to finally end your thyroid nightmare. You may be wondering, what makes me different from every other doctor that you have seen? Well, the answer is that I treat you metabolically and neurologically. We have a great approach to treating you. We have a program that has been around for over 10 years that several hundred doctors, excuse me, several hundred doctors across the country are using to treat thyroid problems. Before we formulate a treatment plan, we run in-depth tests to determine just exactly what your thyroid problem is. We do sensitivity testing, a complete metabolic panel, a lipid panel, a CBC with autodifferential, adrenal stress index test. We check immune panels, intestinal permeability, we run hormone panels, and we check the following thyroid markers: TSH, free T3, free T4, TBG, total T3, total T4, FTI, resin T3 uptake, and thyroid antibodies. Then, after we get all the test results, we analyze the results, and then we formulate a specific treatment plan just for you. Your specific treatment may consist of a combination of any of the following: specific neurologic and metabolic treatments to get you better faster, such as oxygen therapy, brain-based therapy, physical therapy, lifestyle changes, glutathione, an amazing antioxidant, and other nutritional supplements. Once we have run the necessary tests to determine your specific condition, we can treat you via proper neurologic and all-natural nutritional protocols. In conclusion, this DVD is full of life-changing information. Your thyroid problem is like a thief stealing your good health from you. Let me be the police and stop the thief by looking at you as a whole person, by utilizing brain-based therapy, brain-building technology to get you feeling like you used to feel. My intent is to help you accomplish your goals. Now ask yourself the following questions. How has my thyroid condition affected my relationships, my finances, my family, or my other activities? What has it cost me in time, money, happiness, sleep? Where do I picture myself in the next 1 to 3 years if this problem is not taken care of soon? What is it worth to me if we could improve your conditioning? Finally, share this information with a family member or friend who may also be in need of this life-changing information. I am offering 2 free visits to see if you are a candidate for care at my office. This offer is only good for a short time. Patients who respond sooner can get started on the road to good health sooner. I do not accept all cases, only those cases that I truly feel I can help. I am looking for patients who are fed up with their lot in life. I'm looking for patients who will do whatever it takes to get better. If you would like to schedule your 2 free visits, call 630-860-0480 or leave your contact information in the contact area of this website. Also contact us if you would like more information about our thyroid program. We can send you our more comprehensive DVD about the thyroid. So now it is up to you to take charge of your life and begin the journey to feeling good again. Thank you.